You. My name is Charity Chilufia Banda to be with you until 17 hours or so. Well, today I have a very special guest, and we are privileged to be joined by Dr. Yaman. She will introduce herself fully in case I make a mistake in pronouncing her name, but she's a gynecologist, and because we are discussing women issues, she's here to help us understand what fibroids are. Really, we are privileged, and please feel free to ask her any questions about women, especially on today's topic. Doc, welcome to the program.
Thank you so much. Good afternoon, Charity. How are you?
Fine, thank you. Good to have you here.
Thank you so much.
You look beautiful.
Thank you.
Okay, so kindly inform the viewers who you are, tell them your full names and what you do and where you're from.
Yeah, I'm Dr. Yaman Shahid. I'm consultant gynecologist and obstetrician at Rehan Hospital. I'm from Pakistan. I just recently joined the Rehan Hospital for dealing all the women issues. Like they have multiple issues like fibroid uterus, which I'm discussing in detail today.
Okay.
And moreover, they can also have a multiple problems like since puberty to menopause,
Okay.
like not conceiving, which is called infertility. Moreover, they have like the STI, sexually transmitted infections,
Okay.
which we deal very well. And moreover, we can also have they have abnormal uterine bleeding, which is very commonly associated with the topic today we are discussing. Moreover, they have infertility issues. So I'm dealing with all the female issues like from having from puberty to menopause
Thank you.
at Rehan Hospital.
Thank you so much, Doc. So, dear viewers, you've heard for yourself, we are privileged. She is a gynecologist, so feel free. At least there is hope for women, there is light at the end of the tunnel. You know that when you have a gynecologist, then almost all your problems are sorted. You will visit Rehan Hospital and you'll find her. By the way, consultation is free at Rehan Hospital. So she's not here to just sell herself, but she's here to help other women, give you hope so that next time if you have fibroids, knowledge is power, you know what to do. But the best is to visit the hospital. And that's why we are hosting Dr. Yaman so that she helps us understand fully. She's a medical doctor and also a gynecologist as a specialist. So she's here to help us understand fully what fibroids are. This is a common problem in women. Please do not go away. Stay tuned until the end of the program so that we get something. Knowledge is power. So, Doc, first things first, what are fibroids?
These are basically we can say the non-cancerous growth. It's like we can say it could be a benign, it could be a malignant, but this the fibroid is basically a growth which is present and it is located on different side of the uterus in the it's more common in the reproductive age of the woman life.
Okay. Can I feel it? Can I feel it?
Yeah, if you
Okay.
have a fibroid growth which is larger in size, we can palpate from the abdomen.
Oh, okay.
Yeah.
So, what are some of the causes? Why should a woman have fibroids? What causes fibroids?
Oh, so Charity, we have a different risk factors and different causes of like some may have a definite like we have a reason to explain, but some are correlated with it with the fibroid. Like I told you, one of the most common is like the age, in the reproductive age. But it started like we can say in 20s, 30s, but but as this age grows, like in the 40s and the 50s, it is very common.
Okay.
First of the main common factor is the age. Secondly, it is associated with your parity. Sometimes the patient report to us with that they never get pregnant. So the nulliparity, like they never conceive, they are never pregnant. So this can lead to the fibroid nulliparity. The next we can say if you have a early menarche. The word menarche means that if you have a menstrual cycle before the age of 10 years or at the age of 10 years, this can also have like we can say this can also lead to the fibroid formation. Moreover, we can also say some ladies report to us that our bleeding don't stop at the
Stop.
age of
Prolonged.
50. Yeah,
Prolonged
50 to
periods.
55 years. So
Okay.
it's like a delayed menopause. This can also lead to the fibroid formation. Moreover, we can also have like in your country in Zambia, the black women are more prone to have a fibroid formation as compared to other ethnicities. So black women are prone for it. Moreover, we can also say is that there are like your daily lifestyle modification. Your obesity can also lead to the fibroid formation. Your lifestyle, like we can have more eat meat in the food. This can lead to the fibroid, red meat.
Okay.
So from here, just want the people take this message to home. Keep your diet balanced. Don't take like we can't say that don't eat only red meat. You can have a vegetables, fruits,
Fruits. Yeah.
and have a dairy products
Okay.
for your. This can sometime the lifestyle modification can improve your symptoms rather than we do the surgery and we do the medical management. So for the women's right now, I will say have a balanced lifestyle.
Okay.
You can have exercise. You have a gyms available around, so we can have a good exercise, a healthy lifestyle, a healthy balanced diet. That's all. Moreover, the most important, it runs in the families. This is the most important message. Yeah, it's a
Genetics.
genetic. The
Oh.
most important cause is genetic. Sometimes the patient report to us, and I ask, do your mother have suffering from this? They say, yeah, my mother have a fibroid. The
Oh.
sister have also the fibroid.
Mm.
So this is a genetic predisposition.
Ah. Okay.
And stress is a bit related to the fibroid, but no definite cause available. They like we don't have a definite cause for it, but stress can also lead to it. And moreover, we can also say like it can be related to one of the most important point which I'm trying to focus is that if we diagnose early the fibroid, this can put a lot of preventive, like we can have a better lifestyle, we can have a better outcome. But if we pick up the fibroid at the later stage, so this can lead to many things, like you have abnormal uterine bleeding. We have one of the most common issue is like nowadays is infertility.
Okay.
Peop-
So let's look at the symptoms and signs and symptoms, okay, of fibroids. How can one suspect if I suspect that I have fibroids? What should I look out for? What are
First
the
of all,
symptoms?
what the common symptoms which patient report to us is the abnormal uterine bleeding.
Bleeding.
This
Okay.
bleeding is not of the pattern like spotting. No. The bleeding which is associated with the fibroid, it's heavy, it's prolonged, and it's intermenstrual bleeding. And the because of the bleeding, the most other important disease which originate from the bleeding is anemia, like your HB falls.
Yeah.
Women feel
Yeah.
lethargic, body aches. So this can also lead to the like because of the fibroid, we feel like abnormal uterine bleeding leading to the anemia. Next, we can also have the patient, like it's normal that we feel like pain on the first 2 days of the periods, but sometimes patient complain that she has prolonged painful menses, which is called menstrual cycle. She has a painful menstruation. This is called dysmenorrhea. So if the patient is complaining of severe dysmenorrhea, which is only get relieved by the IV, like injections,
Okay.
so this can be because of the fibroid. And moreover, you have a painful coitus, which is called dyspareunia. And patient can also have a important symptom is that infertility. You are so just for the public, women should realize, if all of the other causes are ruled out, 2 to 3% of the fibroids are associated with the infertility. So we
Okay.
have to rule out the infertility also. And sometimes the patient has urinary and the bowel symptoms, like patient is suffering from constipation, or sometimes they don't have put control on the urine. So this can lead these are called pressure symptoms. This is because of the fibroid.
So a woman with fibroids cannot conceive.
No, it's not like that. Woman, we treat multiple women who can conceive.
Okay.
But keeping in view, it's like a journal which I'm trying to give the message that the number of the fibroids, how many number of the fibroids within the present the uterus, where they are present. Just telling you that there are different types of fibroid. They are submucosal, intramural, subserosal. It's they are named according to their locations.
Okay.
So locations are very important while we are telling someone that is she conceived or is she do not conceived. Moreover, the fibroid, which is near to the endometrium is a place where the implantation occurs. So if the fibroid is close to it, so
And
we'll
it's
explain.
big.
Yeah, it's breaching the endometrium. So what I'm going to tell you, the number of the fibroid is very important. The location of the fibroid is very important. Either it's breaching the endometrium or not, it's very important. And rest we can say, like if there is a big fibroid which is blocking your tubes, so you won't get pregnant. So these are the factors which are very important. We rule out initially, then we can say either it's easy to conceive, either it's easy not to conceive.
Okay. So in short, fibroids can affect pregnancy.
Yeah, it can, depending upon the size of the fibroid, can affect the pregnancy.
Okay.
Sometime in pregnancy, the fibroid size won't get larger. Okay, it remains same, but sometime it become larger. When there is no space inside the uterus, the baby will not grow. This will result into the miscarriages, like abortion.
Oh, yeah.
Sometime if the baby grows, the fibroid size also grow, because one of the most important risk factor is also your hormones. In pregnancy, the hormones get higher, higher, higher. So when the hormones get higher, the fibroid will have more food, will have more blood supply. It will grow with the baby. So we can have a recurrent miscarriages. We can moreover have a preterm labor. This, the woman will not reach to the end of the pregnancy. She will deliver early.
Yeah.
So sometimes we have a malpresentation with the fibroid, like we try to deliver the woman normally, in normal vaginal delivery, but we have a fibroid. So if there's a big fibroid present in the uterus, the woman will not get delivered normal.
So what's the best way to know if one has fibroids? How can a woman know?
Like this woman should come to us for the screening. Like we do the there are two type of scans present.
Okay.
Like one is a trans abdominal scan and another was in trans vaginal scan. So there are two type of scans, and these are available at Rehan Hospital as well. I'm doing myself in detailed ultrasound.
Okay. So it's not painful. It's transvaginal. It's not painful to
Yeah,
check.
it's a bit painful if a patient has never experienced before, but it's not. But we have a different lubricators which we apply on it,
Okay.
and we do it gently. I myself do in Rehan Hospital transvaginal ultrasound.
Okay, so dear viewers, it's good to have a gynecologist who is a woman in case you are not comfortable with a man checking you. Dr. Yaman is here to help you.
Yeah.
In case there are those women who don't feel comfortable to be checked by a male doctor, but when you're in pain, I mean, pain is pain, so you can still be checked by anybody. But Dr. Yaman, you are lucky, viewers, that you have Dr. Yaman. She's a woman and she's a gynecologist. She can check you, and please feel free. So you visit Rehan Hospital and you find her waiting for you there.
Yeah.
So that you be checked. It's always good to be checked. Do not assume that you have fibroids. You are not a doctor and don't check yourself. The best is to go to the hospital, go through the scanning and also do the ultrasound. Then they'll be able to advise if you have fibroids or not. And remember, she explained to say it also depends on where the fibroid is located. Okay, so as a male person, as a lay person, you will not know where the fibroid is until you are checked by machines and told by the doctors where it is located, if it is in the uterus and how big it is. Also, the size matters, right?
Yeah.
Okay.
It's like sometimes the size is very small and it's affecting your quality of life. Like the patient is heavily bleeding, she's going to face anemia, having multiple blood transfusions, getting iron tablets, iron injections. So three things are important, like where it is located. Three things for the journal public can have three things: where it is located, how the number of the fibroids, and what is the size of the fibroid.
So all that can only be known after checking by ultrasound.
Yeah, ultrasound.
Okay. Are fibroids dangerous? Are they life-threatening?
Cherry, we can't say that they are life threatening, because nowadays we have advanced systems, like we have a good ultrasound machine, so we can pick it early. Like when a patient comes to us, we do ultrasound, and there and then we can diagnose the fibroid. And if, in my point of view, if the size is small, it's not affecting the quality of life, patient is not so we should not in my opinion, we should not
Temper
go for
with
the
it.
medical
Yeah.
management without any symptoms, going for surgeries. There is no need,
Okay.
because one thing, keep in view, when we do a surgery and we remove the fibroid from there, so there are 15 to 30% of chances of recurrence. Yeah.
Okay.
Sometimes because before going for the surgery, we explain all these pros and cons to the patient. But sometimes the surgery is important and it's a definite management. So keeping in view the patient concerns, the fertility concerns, of course a young patient come to me with the fibroid, I will not ask her to remove your uterus. It's not like that.
No.
We have a different options in this, so we treat like that. But
Okay.
sometimes the surgery is a definite treatment. So we have a later half. I will explain you about the surgeries as well.
Okay, yeah. So, but then let's look at treatment because we're already there. Let's look at how you treat fibroids. Is it only by surgery, or there are tablets, or there's medication that you give to shrink?
Yeah.
Uh, and variety of treatment?
Yeah, Charity, I just focusing again and again the number of the fibroids, the location of the fibroid, whether it's distorting the uterine cavity. Moreover, these factors are important when we do ultrasound. We explain everything to the patient.
Okay.
So we have a multiple options for the management. We have a medical management. First, I'm going to explain here the medical management. If you have feel any any question, you can ask me.
Yeah, sure.
Like for the medical management, we have, first of all, why we give medical man. We feel like there's a fibroid in the uterus like this. There's a small fibroid in the uterus of this is a fibroid. But I'm offering the medical management to the patient. Because of this, I just want patient won't get anemic, she won't get more bleeding, her quality of life improved, and moreover she can have a time between the surgery and the normal time, so she can have a gap between the surgery.
Okay.
That's why we give medical management. There are different type of medical management. We have a different oral contraceptive pills. Now I feel like you people will say it's a contraception. No, this can also be deal with the, because I told you early that abnormal uterine bleeding leads to the, because of the
Anemic.
fibroid anemia. So we can give oral contraceptive pills. This can have a better outcome and this can control like uterine bleeding.
Okay.
So we can have a progesterone only pills as well, which is available in the name of a danazol. So I'm not going into the details because general public will not understand.
Exactly. Yeah.
So just keeping in view, there are the oral contraceptive pills which we can give to the patient. Sometimes it's not directly linked. It can reduce the size of the fibroid, but it's not the definite one that it will reduce it, but it can improve the symptoms.
Okay.
And we have another thing which is GnRH analog. It's a very good thing. It can, the studies shows, and we are using in the practice, that it can reduce the size within the 3 months.
Okay.
GnRH analog.
Okay.
Yeah, it can available in different like nasal sprays, subcutaneous. We have available in the injections form, so it can reduce. But within the 6 to 12 months, if we stop repeating the injections, so it can lead to like again the growth of the fibroid. So for somehow we can before going for the surgery, if we have a big fibroid and
And it shows your stomach as if you're pregnant.
yeah, sometimes, so we can give GnRH analog in those patients, so it can shrink the size of the fiber, and then we can proceed for the surgery.
Okay.
And sometime when we go for surgery for fibroid, sometime we don't get definite planes how to cut because the fibroid is big. So GnRH can also help us in getting the proper planes before the surgery. An important factor is that it will reduce the size of the fibroid, and it can also help to restore the anemic level of the patient, so patient won't get anemic in it.
Okay. So it's not a must that all fibroids are cancerous. You said fibroids are non-cancerous.
Yeah.
So they can't, any connection?
Yeah, they can be cancerous because we have a leiomyomas. These are basically, what are the fibroid? These are basically, Charity, smooth muscles hypertrophy. It's a muscles layer which get hypertrophied, so it becomes a fibroid. So, a patient with continuous bleeding, bleeding not controlled by medical management, it's bleed, bleed, bleed. So, there is a word like we do endometrial biopsy.
Okay.
It's like that
Yeah.
we when a patient have a multiple fiber, she's a young, so before proceeding for the surgery,
You
it's
cut
like
a small
I'm not
piece.
going in much detail because the general public will not understand my
Understand? Yeah.
point.
Yes.
But sometime we have to rule out either it's cancerous, either it's not cancerous, so we
Yeah.
take the biopsy. It's a small piece.
Piece. Yeah.
And don't worry, we don't take in operation theaters, we can take it in a OPD.
Oh.
It's a
Okay.
OPD procedure, and we send it for histopathology.
Okay.
Then we can decide either it's cancerous or
Or
it's not
not cancerous.
cancerous.
But can fibroids clear on their own without any treatment, without medication?
No,
Can they
no, no,
go?
no. Sometimes the patient, in my practice, the patient come and says, doctor has, some doctor has given me medicine. Might be patients keep satisfying themselves that my fibroid goes.
Mm.
No, this is not like fibroid
They
never
can.
goes. You have to go for the medical management, and the definite medical management is just to improve your quality of symptoms. It's not like it will reduce the size of the fibroid. Sometimes we have a small fibroid, so we leave it.
Okay. You just ignore it instead of
Yeah, it's
disturbing
not,
it.
if not producing any symptoms, if the patient is not infertile,
Mm.
she's conceiving properly, she is having not any symptoms, so we don't bother for them.
Okay, so just for the sake of the viewers, Dr. Yaman, you said among the symptoms is excessive bleeding, okay? Menstrual period, excessive bleeding, or heavy bleeding. How long, what's the normal? How long, how many days, and what is not normal? So,
Like this,
women, what should a lady look out for?
like if a patient comes to, most of the patient comes to us and they say we are heavily bleeding, like we are continuous changing our sanitary pads, we are going washroom, and it like coming like a urine, the blood is coming like a urine,
Mm.
and we are continuous changing 7 to 8 pads in a day, and bleeding is not stopping, like we have a normal menstrual cycle up to 5 days, and the next 2 days we have just a spotting. So if it continues for 7 to 10 days and then again come after 10 days, so it's like abnormal bleeding.
Oh, yeah. Okay, which can lead to anemia.
Yeah.
A person can be anemic. Okay, so what are some of the complications if the fibroid is left untreated? What complication can that come with?
Sometime the, if the degeneration of the fibroid, like sometime we can say if there are some changes which can produce like necrosis, so it can have a patient have a chronic pelvic pain. Sometimes the fibroid get twisted on the pedicle, so patient have a severe pelvic pain. Moreover, the complication, she will remain anemic, she will have a abnormal uterine bleeding. One of the most important, young patients which are suffering, they are infertile, they are not conceiving on their own.
Okay, so if it's you said one of the risk factors, fibroids come with age, but we do have people who are 30 or even below 30 but with fibroids, meaning it's genetic, right? So what do you do, and a person has never conceived before but they have fibroids? Do you take them direct for surgery, or what happens then if they visit the hospital?
I told you that I will ask about the symptoms and what are their concerns. If the infertility is a concern and there are like multiple fibroids, so I will directly opt, because medical management sometimes lead to the premature ovarian failure. So we can have, keeping in generic analog, which I told you they are available in injections, but they can lead to the premature ovarian failure. So for the young ladies, don't go for like
Surgery.
injections which can lead to the early menopause. So keeping in view that if the patient comes to me and she has a multiple fibroids, so I will prepare her for the minimizing her anemic level. I will go for the there is a procedure which is called myomectomy.
Okay.
It's like we preserve the uterus, we just go inside the uterus and we just remove the fibroid.
Okay. And you did mention to say sometimes it does come back.
Yeah,
Okay.
after the surgery.
After the surgery, sometimes it does come back. So, how long can one stay if I undergo surgery today? How long should I? How long will I stay before the fibroid comes back?
Charity,
Or
it's
it
not,
varies. It
yeah, it
varies from
varies.
it
Yeah, it
varies
varies.
from
It's not
person
like
to person.
written in specific like 6 months, 7 months. Like whenever we being because I'm in this field, we go for the surgery. I learned from my supervisor as well. We should remove firstly the small fibroid. Sometimes we say leave the small fibroid and go for the big
Big
one,
one.
but when the big ones are removed, now the small one will have more blood supply and more food to eat, so they will grow faster. So whenever we are going for the surgery like myomectomy, which is like we preserve the uterus and we remove the fibroid, so it's important we remove each and every fibroid.
Okay. And would you encourage women to go for myomectomy?
Yeah, because if she's not conceiving and the fibroid is present inside the uterus, like it's submucosal, intramural, so we have to remove the fibroid.
Okay. So let's hear maybe Dr. Yaman. I think you've explained quite a lot. Let's hear what the public has to say. If the viewers have something to ask you, if they have any questions for you, now we can now open the line. So, dear viewers, remember, if you are watching us on DSTV, please feel free to call. The line is now open. If you are watching us through via Facebook, feel free to drop a message and we'll be able to read your messages. The number to call for those following us on Facebook is 0776 409 840. We are discussing fibroids. If you have any questions, please drop us a message or give us a call. 0776 409 840 is the number to call. I am with Dr. Yaman. She's a gynecologist and she's here to help us understand what fibroids are. These are women issues and fibroids are very common. Among the risk factors, she did mention to say being black, okay, as an African, you are prone to that. So if you have any questions, dear viewers, please feel free. The line is now open. You can participate by calling 0776 409 840. We are discussing fibroids. Remember, feel free to speak in any language. She will still explain. Do not feel bad. She will understand. She understands all the languages. So Dr. Yaman is here to help us understand what fibroids are, and she has explained really that what fibroids are. If you have any questions, concerns, please feel free. And if you are watching us on Facebook, drop us a message and we'll be able to read it. 0776 409 840 is the number to call.
Hello.
Hello, good afternoon.
Hello.
Hello, good afternoon. You are through to Prime TV.
Mwabomba shani mkwai.
Wino mlishani mkwai.
Mwabomba shani.
Wino mlishani. Fumeni ku TV. Stay away from your TV set.
Mkwai.
Fumeni ko ku TV. Fumeni ko ku TV kumwenu.
Dekoringa mkwai kufuma kumkushi.
Mkushi,
Kumasansa.
Okay. Mkwai.
Hello.
Hello, ndemi ufa mkwai kumkushi.
Hello.
Hello. Fumeni ku TV.
Hello.
Ndemi umfa.
Dekoringa kufuma kumkushi kumasansa.
Mkwai. Go ahead with your contribution or question.
Dekoringa kufuma kumkushi kumasansa.
Mkwai.
Line tairibu.
Okay, so dear viewers, remember when you call, stay away from your TV set so that we don't get feedback. Stay away from your TV set or reduce the volume to 0 so that we move together. Our caller from Kushi, hello, good afternoon. Okay. It's good we had a man calling, meaning even men are watching and they want to find out on behalf of their women. Hello, good afternoon.
Mwabomba shani wa mami.
Wino mwabombe ni mkwai.
Mkwai. Dekoringa kufuma kumkushi kumasansa.
Mkwai.
Ine nalikwata ko problem yo ine ya ma fibroids. Kashinga ma fibroids panto atendi nalekero kuchitanishi ndina 35 inomba pandina 50 years.
Muna 50 years?
Mkwai inomba kutina conceive nangushani nga bati bamfunye.
Mlefo kuchita conceive pa 50 years.
Mkwai.
Tamwa kwata po mwana.
Na kwata fe umofye.
Mwaru kwata po umo.
Mkwai.
Okay, but tamlafika menopause.
Ndina 50 nomba.
Muna 50 tamlafika menopause.
Nimfika.
Nomba. Okay. Wala yasuka wa doctor. Twatotela sana.
Kaidi ukufuma 35 ukuisa fika pali 50.
Mkwai.
Shachitapo eso fine nalireka kale naleka nabase pa menopause.
Oho. So mlefa kumonanga kuti babyafuirisha mwakwata.
Emkwai.
All right. Thank you so much. Vala yaskoba doctor. Okay, so that's our caller all the way from Kushi. She has one child, she's 50 years old, and she wants to conceive. She's attained menopause already, but she wants to know if there's chance so that probably she can travel. But you respond to her later. Let me try and pick more calls. Hello, good afternoon. Hello. So our dear viewers, please remember to stay away from your TV set when you call. Those following us on Facebook, you can participate by calling 0776 409 840. We are discussing fibroids. Our caller all the way from Kushi, the doctor will help you understand or she'll respond. If you have any questions, concerns regarding fibroids, please feel free to call. But remember, when you call, stay away from your TV set so that we don't get feedback and we move together. The number to call is on the screen for those following us on DSTV or GoTV or Topstar. If you are following us on Facebook, the number to call is 0776 409 840. We are discussing fibroids. What do you want to know about fibroids? Are you affected? Is your wife affected? Is your sister affected? So please feel free to call, and Dr. Yaman is here to help us understand. So maybe you can respond. As we wait for the callers, you can respond to our caller from Kushi. She's 50 years old, she's attained menopause, and she has one child, but she wants to conceive. Is that possible?
Yeah. Thank you her for calling us.
Okay, we have a caller. Hello, good afternoon.
Good afternoon.
How are you, sir?
I'm just English.
Hello?
Hello.
Yes, sir. Go ahead. Where are you calling from? Hello? Remember, like I said, please stay away from your TV set. There's no need to watch yourself. There's no need to watch yourself because then we are getting feedback. Just call and stay away from your TV set. You are watching Prime Television and we are discussing fibroids. Hello, good afternoon. Okay. So.
Okay, should I respond to the first question? She's asking, she's 50
right.
years old.
Okay,
And
just hold your thought. We have a caller. Hello, good afternoon. Hello, good afternoon. You are through to Prime TV.
I'm calling from
Yes, go ahead. Where are you calling from?
Ikeleng.
From?
Ikeleng.
From Ikeleng.
Yes.
Okay, go ahead with your contribution or question, sir.
Yeah. Trying to ask, which do you have this for fibroid?
You are not very clear. Please stay away from your TV set if you are near your TV, sir.
Okay, I'll stay away. Yes. My wife has got fibroids.
Yes,
My
go
wife
ahead.
has got fibroids.
Your wife has fibroids.
Yes.
Okay, so what help do you need?
Do you have medicine?
Come again?
Do you have medicine for fibroids?
Medicine for fibroids.
Yes.
Okay, so the doctor was explaining the options that are there for fibroids. Has Madame been to the hospital?
Yeah.
She's been. How old is she?
40.
She's 40.
Yes, madam.
And
Do you have children?
Yeah.
I have 6.
You have 6.
Yes.
Okay, so you just need medicine for her.
What are the, can you ask
Yes.
me what are the symptoms?
Okay. So how did she know she has fibroids? Did she go to the hospital?
Yes, she went for
And they didn't give her any medicine?
and so then she was detected that she has fibroids.
Okay. Do you
Yes.
have any questions for
Yeah.
you?
Can I ask what are the symptoms which she's facing with the fibroid uterus?
Sorry?
What are the
Symptoms.
symptoms she is facing? Why you need medicine?
Come again?
Why do you need medicine? Is she going through something?
Yeah, she went something. Then she was saying that she need to be operated.
Okay.
Yes.
All right. Thank you so much. The doctor will respond. She'll go through again the options for treatment. Thank you so much for calling. So that was our caller all the way from Ikeleng. The number to call is on the screen. If you're following us on Facebook, please feel free to call. And remember, dear viewers, when you call, please stay away from your TV set. It's just that simple.
Hello.
Hello, good afternoon.
Good afternoon.
Yes, you are through to Prime TV. Kindly tell us your name and where you're calling from.
Hello, Mabomben.
Mkwai Mwabombeni.
Mabomba chani.
Mkwai twabomba fe wino. Mletu mina
Ya
kwisa.
mkwai.
Mletu mina kwisa. Hello. Okay, so maybe the network or she's run out of talk time. Hello, good afternoon. So our dear viewers, please stay away from your TV sets or just reduce the volume to 0 so that we don't get feedback when you call us. We are discussing fibroids and Dr. Yaman is here to help us understand what fibroids are. And I'm happy that there are also men calling, meaning they are also affected.
They are concerned.
They are concerned.
Hello.
Hello, good afternoon.
Hello.
Hello, you are through to Prime TV.
Hello.
Hello, you are through to Prime TV.
Hello.
We seem to have
Might be there.
Hello.
network problem, depending on
Nakwera na kaidi ne wachikolinga pamba wanu.
Mkwai.
Ndofana mumala kalipashe lyonse kyokukalipashe.
Okay. Mumala pen.
Mumala mula kalipashe ndakwata peni fye nshitafyo lyonse.
All right. Okay. Bala yaskaba doctor.
Okay.
Thank you. Okay, so the number to call is on the screen. So the woman who called said she's the one who called at first, and she's saying she experiences a lot of pain. Other than her wanting to conceive, she also experiences pain.
So can I answer by?
Okay, let me just pick this call. Then
Hello.
Hello, good afternoon. You are through to Prime TV. Hello, you are through to Prime TV.
Hello.
Mkwai.
Hello.
Hello, you are through to Prime TV.
Hello, Mabomba chani.
Wino Mwabombeni Mkwai.
Wino Mabomba chani.
Wino. Mle tamba Prime TV. Tulanda pama fibroids.
Kwa kulanda fibroids.
Mkwai. Namkwata kweli pusho. Hello. Okay. So we seem to have a network problem depending on where one is calling from. So you can respond to.
So the number one patient which she called, like 50 years, she want to conceive, and she knowing her status of menopausal. So I don't want to disheart her, but her levels are very low. Like there is a level which is called AMH, which can tell us the ovarian reserves. When your body hormones level decline, how you get pregnant. So it's not possible like that. Sorry for telling her, but she can't conceive because her ovaries are not functioning, and there are multiple other maneuvers which come across the age of 50. So the next question is the 40 years with the parity of sex, and she is having the fibroid uterus.
Yes.
So if she's a diagnosed case of fibroid uterus and she is not infertile, so I'm going to just asking them what are their symptoms. Are she having the like a prolonged periods, moreover having the pain, What are the symptoms? That's what I'm asking, but because of the network issue, I couldn't understand it
Yeah,
properly.
yeah.
And the third one is with the fibroid uterus, she want to conceive. But
The pain
first
also.
of all, the question is that what is the severity of pain? How much pain she suffers? Like 1, 2, 3. Is the pain remain in the periods? So we can have a painkiller. We can give it to it. The next is she is infertile, as per she says. But I want to know, has any workup done,
Okay.
like for her husband and for her? And if the workup is done, what is the problem there?
Okay.
So it's better if you are young, like you are not crossing the age of 40. You are young, and you know the definite reasons the fibroid. You are not getting conceived, so remove the fibroid.
Okay. So the best is, in as much as we bring doctors here, remember they don't give solutions here on TV. The best is to visit the hospital, go there so that you are examined fully and they'll be able to advise. That's the best thing we tell people here. Remember, Dr. Yaman is a gynecologist and she can only tell you what the problem is after checking you. Then she can advise. Otherwise, we can't give solutions here on TV. It's just the basic knowledge to understand. Also, so Dr. Yaman, there's a message on TV. Dr. Yaman, please guide. What's the best age to get pregnant? Do women above 30 years of age have higher chance to get fibroids? Bilal Amir.
Yeah.
Okay.
It's like, yeah, there is not like that every woman has a higher chance of getting fibroid. This is not like that. Above the age of nowadays, we are getting married very late, like above 30, 35. So, keeping in view all the things like the uterus pathology, your hormones level, so it's not like that we can only relate if the patient has a fibroid and she can't get pregnant. So, the main point which you have discussed before, that patient has to come to us for the detailed history, detailed examination, and nowadays we have a very good hormones. We can check the hormones level and everything. So, keeping in view all that, then I can say that she can get pregnant or
Or
not.
not. Okay.
Yeah.
Thank you so much, Dr. Yaman. The number to call is on the screen. If you're following us on Facebook, please drop us a message. Dr. Yaman is here. She will respond. So the number to call is 0776 409 840. We don't have much time, and remember, it's just an hour. So if you have any questions, feel free to call the number on the screen. If you're following us on Facebook, you can drop a message, and Dr. Yaman will respond. Okay. Hello, good afternoon.
Good afternoon, madam.
How are you, sir?
I'm very fine, madam. How are you?
Fine, thank you. Kindly tell us your name and where you are calling from.
You are speaking to Mr. Mtombe in Mkushi.
Okay, go ahead, sir.
Yes, madam. Me, I just wanted to know, madam, the source of these problems in my fibroid. I have mine. What could be the cause? Is it food or tender body? They come about.
Okay.
Because long time ago, we never used to hear of fibroid. Where could
Okay.
the source be?
Okay.
Thank you so much.
Thank you so much. You are a concerned man, and thank you for calling. We need more calls. Maybe we can pick more, 2 or so calls. Hello, good afternoon. Hello, good afternoon.
Hello.
Good afternoon. You are through to Prime TV.
Good afternoon.
Afternoon. Kindly tell us your name and where you are calling from.
My name is Kaunda Katotowe. I'm calling with Nosaka Talala.
Okay, Mr. Kauda, go ahead with your contribution or question.
Hello.
Go ahead with your contribution or question, Mr. Kaunda.
Hello.
Yes, sir. Go ahead.
Yes, I wanted to find out. Sometime last year, me and my wife went for a checkup. So
Yes.
she was told that she has fibroids. Actually small. But after a few months later, she conceived. She became pregnant. Within 3 months, she had a miscarriage. So I don't know what really caused. Was it the fibroids? Or we just told medication, but we didn't purchase the medication because we were told it's too small.
Okay.
So can the fibroids cause somebody not to conceive, or what
How,
can be done?
how old is your wife?
Hello?
How old is she?
Hello?
How old is your wife?
She's 30. She turned 30 last year.
She's 30. So after that miscarriage, after the miscarriage, you don't have any other child?
No.
No.
We
And
recently
you
got
people are
married
living
just about 2
together
years later.
afterwards.
Yes.
2 years ago. So now we're trying to have to start up a family.
Okay.
That's when we went to IVF clinic. That's
Yeah.
when we went and she underwent the scan, which was told there are some fibroids, but they were very, very small. So we were told if you want to get rid of them, you can come back. It's just the medication that I can assist you, not the operation. Then after months later, she became pregnant. That was in December.
Okay.
Then mid-January, she had a miscarriage.
Miscarriage.
Sorry.
But she did know that she was just normal until we went for a scan. But she checked how the baby is faring. That's when she was told, no, the baby stopped growing. So we don't know what
It's a missed
transpired.
miscarriage.
Is it fibroids or what?
All right.
We're not told the reasons why the baby stopped
Yeah, it's
growing.
not.
But we
Okay.
were told the fibroids are outside the uterus, so I don't know.
All right. Thank you so much, Mr. Kaunda. The doctor will respond. Thank you for calling Prime
Okay.
TV. The doctor
All right.
will respond. Thank you so much. Okay. I think we can close with calls so that we wind up. We can close, no more calls. Unfortunately, Mr. Kaunda was our last caller, so that the doctor responds and then we can wind up.
Yeah.
Okay.
His concern is that he went to the IVF clinic and his wife has a fibroid. She's 30 years old, young lady. Moreover, she conceived in last December, then she has a miscarriage. It's like that the fetus is not viable. So it's not because, but my first question was the size of the fibroid. And if fibroid is bothering her, then she will not get pregnant. So fibroid is not the reason for her miscarriages. It could be because of the early miscarriages, which can be before the 7 weeks, like we can say before the 2 months. This is because of the we can say chromosomal abnormalities. I don't want to go in much detail, but keeping in mind, he says that fibroid is very small. So why the miscarriage, which is lead, is because of the chromosomal abnormality. So it sometimes can be gone into spontaneous miscarriage. It's not because of the fibroid.
Okay. So I hope you have gotten the answer, Mr. Kaunda. The best is to go back to the hospital and let your wife be checked. It's very unfortunate that you lost that baby, but go back to the hospital and your wife will be checked, and the doctors will advise. Okay. Well, dear viewers, thank you so much. We have to wind up. Dr. Yaman, I want to thank you so much.
You're
you know, time,
welcome.
an hour. You were saying, 1 hour. See how time is passing.
Yeah.
Okay. So your final words to the viewers.
Yeah, my home take message is that I'm serving at Rehan Hospital. Like I'm the doctor who is I'm living very near to my hospital, so I'm available 24/7 over there. In the morning, my fixed OPD timing is from morning 9 to 5 p.m. in the evening, but I can come any time for the emergency. So my main message is that you should not say someone has told you about the fibroid, and the discussion here is not like that every woman should consider we have the fibroid, it's like go to your hospital, visit your gynecologist, get your screening done so that you can be properly treated. So every woman is not like that if she has a fibroid she never get pregnant. No. So we have a multiple medical management and we have a surgical management associated for the fibroid. So please visit to the nearest hospital, consult your gynecologist. Don't overthink, don't take stress for it that we have a fibroid, that's why we are not conceiving.
Okay.
And we have a multiple assisted reproduction techniques like IVF, IUI, ICSI. So we try best to give the best services. And for the last thing, I'm going to tell all my viewers that at Rehan Hospital we have also the IVF facility available.
Okay.
So they can visit me over there at the Rehan Hospital. I can also share my contact number with my viewers. It's like 260 570204518. I can also give them online consultations if they want.
Okay. So what is important, the key message is that consultation is free. They can come and see
Yeah,
you
I can offer them.
anytime.
Tomorrow, I'm also doing the free Sunday medical camp at
Okay.
Rehan Hospital. They can
Okay.
come over there. Moreover, we are giving the best services, whatever the patient wants over there. I'm doing the detailed consultation, the pap smear, the HVS, the STIs panel, all we are doing over there. And I can also do the myself this detailed scan, both the trans abdominal, trans vaginal. So we are giving the best gynae op services under one roof. So
Okay.
patient don't have to go anywhere else for the ultrasound.
Okay. Thank you
That's
so
all.
much. Dr. Yaman, do you encourage women to come to the hospital with their husbands, or they should come on
Yeah,
their
I
own?
feel comfortable. Male should know, a husband should know where the problem is. We
Then
should
you
not
explain.
blame. No, we should not blame women for everything. Yeah, male should come and he should understand what's the problem. Nowadays we have a qualified males. The husband, the partner come in, and I don't feel shy if I deliver anything in front of the partner. Both the partner can get better counsel at the same time.
Okay. Well, Dr. Yaman, thank you so much for coming. Hope to have you again. We'll invite you again to come and talk about, since you're a gynecologist and you talk about women issues, we may invite you again to come and talk about something else. Maybe cesarean section, maybe delivery.
there are multiple topics.
Multiple topics
Yeah.
about women. And because your job is to help women. Dear women, at least you have hope. She's here to give you hope. So please feel free to visit her. The best is to visit the hospital. This has been Health and You with me, Charit Chilufia Banda. Until then, it's bye-bye and God bless.